Good evening, everybody, and welcome to tonight's webinar. I'm Sharon Spurlock, and I'm the Senior Director of Family Support at the St. Louis ARC. We are so very happy you came. Our topic tonight is self-advocacy in healthcare, and I'm really excited to introduce you to our friends from the Occupational Therapy Department at Washington University. And without further ado, I want to introduce you to Wanda Mahoney and Katie Walbrun. I'm going to let them introduce themselves and tell you a little bit about their roles at WashU and then launch into their presentation. So thanks for being here tonight.
Thank you, everybody, for attending tonight. I'm Wanda Mahoney. I am an occupational therapist for over 20 years now. I work at Washington University School of Medicine in the program of occupational therapy. I've really focused on working with individuals with intellectual and developmental disabilities throughout my career, from early childhood through adulthood, and really interested in supporting individuals with developmental disabilities so that they can do the activities that they need and want to be able to do. Katie Walbrun is an occupational therapy student who's been working with me for the last 3 years and did her doctoral project this past year in collaboration with the St. Louis ARC. And we're going to talk a little bit about the program that she did, but really kind of give you some strategies and tools to foster self-advocacy, especially in healthcare settings. So this is what we really want you to get out of tonight. We want you to have ways to support self-determination and self-advocacy in healthcare settings that will help to improve the quality of the healthcare that you're receiving and also just general quality of life. We want to practice activities to help prepare for an upcoming doctor's appointment. We're going to help you to locate a specific Charting the Life course tool that we're going to go over and introduce you to, specifically the Today's Healthcare Form visit form, and a couple of other healthcare related tools through the Charting the Life course. And then we're actually going to have you use that tool as a resource. We're going to practice doing that tonight. So just to kind of go over some terms so that we're clear on what are we talking about here. So we named our title of our webinar tonight, Self-Advocacy in Healthcare. We could also say self-determination in healthcare. We could also say supported decision-making in healthcare. All of those things, for our purposes, we're really talking about the same thing. We're talking about people having a say in what's going on at the doctor's office when they're going to a healthcare appointment, of really being the main person who's kind of in charge of those aspects of their healthcare and their life, with supports and with whatever they need to make that happen, and also recognizing that there's going to be a lot of differences in how much people want to be doing that decision making. So really, what kind of supports do people need so that they can make those decisions to the greatest extent possible? We're going to, a lot of times tonight, talk about doctor's visits. Really, that's just a shorter way than talking about like healthcare providers and healthcare visits and stuff. All of these things, we're really talking about the same thing. We're talking about communication with healthcare providers, talking to your doctor, understanding when your doctor's talking to you. And again, we're not just talking about doctors. We're talking about nurses. We're talking about technicians. We're talking about therapists, whether that's a mental health therapist, a psychiatrist, a physical therapist, an occupational therapist, whoever it is. We're talking about anybody that you're interacting with in the healthcare system, and really how to have the person with a disability in your life take a really active role in those interactions with those healthcare providers. And so, what are the issues with this? I'm sure everybody could tell a story about a healthcare experience that they've had that maybe didn't go quite as well as you wish it did. I think that, everybody wants to have good health and good health care. And in general, we hear a lot, like either in the news or in research, or from people telling about their experiences, that a lot of times people with developmental disabilities don't get good health care. And there's a lot of reasons why. Doctors in general don't necessarily have the most supportive attitudes towards people with disabilities. Obviously, not true of all doctors, and some doctors are fantastic. There was actually a recent study that came out that talked about that basically doctors don't know that much about disabilities, and it really impacts how well they provide care for people with disabilities. And something that was really surprising to me the first time that I learned it was that like medical schools are not required to have content about really any disabilities as part of medical school training. And especially with developmental disabilities, if the doctor hasn't had training in pediatrics and developmental medicine, they may not know anything about developmental disabilities. It may not have been part of their med school training at all, or it may have been one day in 4 years. And so I think that's something that I'm actually working with a national committee to help to change. But it's a big systemic problem. We've also just got problems with our healthcare system, with like the way that things are set up with insurance, and with, the healthcare system really wanting us to have like really short, fast visits. And that's not always really helpful for good care. We're not going to address the whole entire healthcare system tonight. That is well beyond the scope of what we can cover and what we can work to improve in this format. But we do know that the communication between patients and doctors is a really important part of good healthcare. And so the doctor listening to the patient, and the patient talking to the doctor, also in a way that's kind of something that the doctor can pick up on and understand. And so absolutely, positively, doctors need to get better in how they communicate with patients, not just patients with developmental disabilities, probably all of us. But there's a lot of existing programs help to work on that, and specifically programs that are designed to train doctors on improving their communication with people with developmental disabilities. Again, kind of beyond the scope of what we're talking about tonight, but I do want you to be aware that these resources do exist. The thing that we're going to talk about is the patients and their supporters working to improve communication. And so that's really where our focus is tonight. So how we're going to do that, and some things that I want to talk about, is we're going to really talk about improving communication through self-advocacy. So tools and resources so that the person with a disability can speak up for themselves. And I say speak up for, but that might involve handing over a form. It may involve how they're responding non-verbally to the doctor and their instructions and things like that. So we're going to talk about some activities and some exercises and do some of those tonight. I also want to remind you that we're talking about developing skills. And anytime we're talking about skill development, it's important to remember that it takes time and it takes practice. There was at least a couple of people who said that they support young children under 12. I would say start now. It's not too young to start working on some self-advocacy in healthcare settings, that, that I would say in that 6 to 10 years old is really an okay time to start. Now, what that looks like is different than what an adult would be doing, but it's okay to start that young. And then also, I didn't notice if anybody was supporting an older adult, but it's never too late to start. So even if you've never done this for yourself or you've never had your family member do this for themselves before, it's never too late to start. I think that we can all agree that going to the doctor and going to the hospital can be kind of stressful. And so these healthcare settings, just by the way that they're designed, we get poked and pushed and people are moving us and stuff. It's a stressful setting. It's a stressful place. And when we're stressed is not when we show our best skills. So we want to make sure that we're practicing those skills in less stressful settings so that we get so good at it that we're able to do them even when we're stressed. And so thinking about, practicing for the doctor's appointment way before you're actually going to the doctor. Sometimes, they're scheduling our physical months ahead of time. It's okay to start practicing for that physical appointment, and what you're going to say and what questions are you going to ask? What part of it are you going to take on? And it's really okay to just focus on one small piece at a time. Maybe for this first time I'm going to try it. What is the easiest part? What's the part that I can be successful at? Maybe it's me telling the doctor why I'm here. That first question they always ask, what brings you in today? Or why are you here today? Maybe I'm going to answer that question. Maybe I'm going to have it written down on a piece of paper and I'm going to hand that piece of paper to the doctor to tell them why I'm here today. So that's a way to, focus on one small part. We're going to talk about some other ways with that too, because just again, to remind you that progress, it takes time and it takes practice. So our focus tonight is really on tools and supports to help people with disabilities be as involved in their healthcare decision-making as they want to be. And so with that, I'm going to turn it over to Katie to share about the strategies and the program that she did and some of the activities.
Okay. So to address some of those, that skill building that we just talked about, I created a program for the ARC called Ready to Advocate for My Health. So this program involved 4 different sessions. Each of them were an hour long on Zoom. And so they were broken up by theme. So the themes for each section were 1, what do I know about healthcare? So the first one is, what do I know about healthcare? So talking about what do I already know about advocating for myself? What skills do I already have? What do I know about going to doctor's appointments, that kind of thing. The second one being preparing for my appointment. So talking about what do I need to be thinking about when I'm getting ready to go to a doctor's appointment? What do I need to be thinking about and bringing with me? The third one being attending my appointment. So what do I need to be thinking about while I'm at the appointment? How do I advocate for myself while I'm there? And then after the appointment. So any follow-up things, medications, those kinds of things that are important to be thinking about after. So within this program, we completed multiple different group activities to work on self-advocacy skills. So we're going to actually do some of those activities tonight, just so you can kind of see what they are, get used to them. And you can use these activities at home or adapt them, use similar activities in the future at home to enhance those skills. So first up, the first thing we're going to do is that during the first session of our program, I used a knowledge survey as a way to identify everyone's current understanding of self-advocacy at the doctor's appointments, as well as just a way to start conversation about some of those topics. So the questions in the knowledge survey were things that through research I identified as just important for people to know about their healthcare. So tonight we're going to walk through a few of those questions using a Zoom poll. First question here is, what should I bring with me to a doctor's appointment? So a list of all the medicines I'm taking, all of my medication bottles, or I do not need to bring anything. I'm seeing most people saying a list of all the medicines I'm taking, and then a couple saying all my medication bottles. So I think all of these things, depending on the doctor's appointment that you're going to, all of these things could be things that you're bringing. Maybe you don't need to bring anything. What we talked about in our sessions were making sure that you have a list of all the medicines that you're bringing and bringing that with you to the appointment.
All right, I just want to add one thing about bringing your medication bottles. Part of it is that that whole thing about the doctor's visit being really short and like wanting to have the information that the doctor's office needs in the way that they need it. So if we bring, like if you have more than one medication and you're bringing a lot of bottles, then that's going to take a lot of time for them to get the information about what are your medications. If you've got it already in a list that you can hand to them, then they've got everything right there. And it helps to use the time that you have with them better.
So question 2 is, if I do not understand what the doctor is saying, what should I do? Hope that someone notices I'm confused, stay quiet, or ask the doctor to explain it to me. Most people said, ask the doctor to explain it to me. And then a couple said, stay quiet. So what we're really going to work towards tonight and talk about is making sure that if you're not understanding, feeling comfortable asking the doctor to explain it to you, or feeling comfortable knowing what your supports are. So if you want somebody else to ask for you, that those things are kind of set up so that you're not just sitting there confused during your doctor's appointment. I know I've definitely had doctor's appointments where I have no idea what they're saying to me. So I think it's important that we build those skills to be able to ask and clarify so that we are able to, be a part of our own healthcare decisions. So why is it important that I participate in my doctor's appointments? It's not important. It is my healthcare and I have a right to be involved, or I will get in trouble if I am not involved. So everybody there picked the second one. It's my healthcare and I have a right to be involved. And that is absolutely true. We do have a right to be involved in your healthcare. And part of it too is making sure that you're involved as you want to be too. So even if you don't want to be super involved, that's okay. As long as that's your decision that you're making, or the decision of your loved one who you're supporting. So then our final question that we'll do here is, what should I do if my doctor is speaking to my support person or parent instead of to me? So the options are scream, ask them to please speak directly to me, or nothing. The doctor's supposed to speak only to my support person. Okay, most people said, ask them to please speak directly to me. And then we also had someone say scream, which would get attention for sure. I think probably the most effective way would be to have them ask them to please speak directly to you. So those are the questions that we went through in our program, or a couple of them. So basically, we went through these questions. We know that at home, you might not be taking a survey, you might not be taking a quiz, those kinds of things. But this is just kind of to give you an idea of what are some of those important things to be thinking about when you are preparing for a doctor's appointment or at a doctor's appointment. What are some of those things that are important to be thinking about?
One thing that I just want to add based on something somebody put in the chat, I think if you've got a child who has limited verbal ability, like you're right, they're not going to be the one to ask the doctor to say like, hey, talk to me kind of thing. I think that's one of the ways too of thinking about, if you're the parent in the room, to say like, oh, Johnny here, he wants to know what's going on too. And that might be a way to deal with that. I think that it's like, if that little kid starts screaming, I think in some ways that's a really appropriate response. It's like, hey, why are you talking about me like I'm not even here? Even though that's not the words they're saying, that might be the sentiment behind that scream. And so, yeah, I think, but we want to make sure as support people too, that we are, or parents, that we are involving that child, that young person, as much as they possibly can be involved. Yeah, and Sharon also mentioned, having them involved by doing something like handing over the list of medication, or showing like where it hurts, or handing over the medical card or something like that. So that, again, it's this thing of understanding that this is about me, and so I can be involved in this.
So then one of the main focuses of the Ready to Advocate for My Health program was practicing how to use this resource called the Today's Healthcare Visit form. So this form was created as part of Charting the Life course, which I know the ARC uses frequently, but for people who are unfamiliar, Charting the Life course is kind of this framework and set of tools for problem solving, as well as decision making, that kind of covers all areas of life. So this specific form is included in their healthy living category. So I'm going to walk through the form, I'm going to talk about it, but before I do that, I want to show you how to access the form, and then have you download it so you can kind of have it pulled up while we're talking it through. So when you pull up the Charting the Life course website, so the website is lifecoursetools.com. So this is what the website looks like when you first get it up. So we're going to go to Life Course Library, and it should have a little drop down. And then we're going to go to Exploring the Life domain. So then it brings up to the left all these different domains. And we're going to click on Healthy Living. So now that you're on the Healthy Living page, if you scroll down, it is going to show you all of these different forms, all of these different supports that Charting Life course has put out. The one we are looking at is on the far right, which is the Today's Healthcare Visit. So if you click on it once, it'll pull up like a little preview, and then download here. Download tool button is right here. As we saw, this is a one-page form. Because it's kind of hard to see on somebody's computer screen, I split it into two, just so that it's easier to read. So this is the first section of the Today's Healthcare Visit form. So this includes kind of your common items here, such as like your name, the date, who's with me at the appointment today. It has a little reminder there to attach your medication list, and then kind of listing what your insurance is, if you saw any other doctor or dentist recently. And then it moves into, why am I at the doctor's or clinic today? So this is a good space to write down your concerns and then refer back to it during the appointment. So are you just going in for a physical? Do you need a reminder to get a medication refill? Is your throat really hurting and you're going in for that? Those kinds of things. Can write that down. So then moving into the bottom half of the form. So it then moves into questions I want to ask today and answers to my questions. So the questions I want to ask today, I also kind of group into things that you can fill out before you go to the appointment. So what are the things that I really want to make sure that I ask the doctor when I go there today? What are the things that I really want to make sure are being addressed? And then when you're at the appointment, able to fill out the answers to my questions. So what is the doctor saying in response to my questions? So I also want to note that these boxes are really small for these questions I want to ask and the answers to my questions. They're really small. And so when we did the program too, we had some people tell us that too, that, hey, these boxes are really small and this is the area that I want to write the most in. So what I would encourage you to do is print the form off and then write it on the back, just so you can write it down. Or if you want to attach a piece of notebook paper or anything like that, just to give you more space to write it down. Because really, what you want to ask the doctor and what they're telling you are probably some of the most important things when you're going to the doctors. And then After, or at the bottom half here, it's my takeaway information. So are there any medication changes, any diet changes? It gives you prompts to write down the medication name, how many times per day you should take it, those kinds of things. And then why do I need to take this? So it's important that if you're putting medication into your body, you're knowing why, what it's for. So being able to write that down and then have that to look back on later if you forget. And then information about today's treatment plan, recommendations, follow-up. Do you need to schedule another appointment in 6 weeks? Do you need to write down the pharmacy that the prescription's being filled in? Those kinds of things you can write down there. So I also want to emphasize that this is a tool that we can all use. So anybody can use this form. I know when I go to the doctor, I like to write down the questions that I want to ask because I know I'm not going to remember when I get there. And I know that I'm not going to remember everything the doctor tells me either. So we can all benefit from writing stuff down before and during the appointment. So this is not just for people with disabilities to use, this is for everybody to use as well. Another thing that I want to talk about too is how we can use this form. So if you or your loved one wants to use the form by themselves, that's great. If you have a child who's maybe too young to write or doesn't want to write it down themselves, those kinds of things, if you're providing more support, it is absolutely okay for you to fill out this form and just do it with them. Have them there and have them watch you fill it out, have them tell you what they want to write down, those kinds of things. It's also okay to write down the questions you want to ask today, hand that to your doctor, and have the doctor see like, oh, okay, these are the things that we really wanted to get addressed today. Ask your doctor to write in the answers on the form. There's all sorts of ways that you can use it. So I want to emphasize that this is not just to hand the form over and have you or your loved one fill it out by themselves. You can do it that way, or you can do it with more support as well. Both are perfectly great ways to do it. So now we are going to practice with the form. I'm going to show a quick video first that just kind of talks about somebody going to the doctor, what they're thinking about when they're preparing for the appointment and going to the appointment, and they actually use the form in the video.
Hi, I'm Andrew. I'm going to see my doctor today. This is what a doctor's visit is like for me. I go see my doctor once a year. When something's wrong, I like to write down what I'm going to talk about my doctor and nurse. I like to go to the doctor by myself. I'm a private person.
You can see your doctor alone or with someone else. It's your choice. Before you go, you can write down important things you want to remember. You can use a form like this one, or even just a notepad. Fill it out yourself or ask for help if you need it. Write down important information about you. Don't forget to make a list of any medications you are taking, and be sure to get your health card ready. Write down why you are at the doctor's today. What is wrong? How long has it been a problem? And if you've recently been to see a doctor or dentist. Tell them what you like and what you don't like about visiting the doctor. Write down what you are worried about and tell them how they can help. Be sure to tell the doctor or nurse what's been bothering you and how you've been feeling. You can mark down where your body hurts on a drawing and tell them how much it hurts. The more they know about you, the more they can help make the visit better for you.
Come this way?
First, I speak to the nurse. She asks me questions.
Okay. So what brings you here today?
I can ask her questions too. She checks my height and my weight.
Great. So let's go do your height and weight first then.
I tell my doctor or nurse if something's wrong, even if it's a private topic.
So I think we'll see the doctor now,
Okay.
and I'll give him the heads up on some of the things that we talked about from this.
Oh, hello. Hi, Andrew.
Hi.
Dr. Scott. How do you do?
Today I wore my clothes for the exam. Sometimes she changed into a gown.
Thank you for doing that. Okay. So, thanks for coming in. So today we're just going to do kind of a complete checkup because
My doctor asks me
we like to do
questions
that
about how I am
once a year.
feeling. It's important to tell the doctor if something hurts.
The first thing I'll do is I'm just going to check your ears, okay?
Okay.
So we have this light,
Mm-hmm.
and it just allows me to look in and see your eardrum. So I'm just going to look in your ear. It won't hurt, and it's not cold, but I'll just let you know when I'm doing it, and if it bothers you, just let me know, okay?
Sometimes the doctor may look at you and touch you.
Just have a look at your teeth first. Very good. And say ah.
Mm.
Okay, good.
I breathe in and out deeply when he listens to my lungs.
Very good. Okay. I'll do that again.
I breathe normally when he listens to my heart.
Out. Good. Okay.
He checks muscles and joints.
So we'll just I'll just check a few of these. Good. That doesn't hurt at all.
No, the doctor may ask me to do things that may be uncomfortable.
So I'm just going to check and see if you
Today,
have any pain. in
he
your
feels
stomach.
and listens to my stomach.
Does that hurt at all?
No,
No. Okay. I'm just going to have a listen if that's okay.
it's important to tell the doctor if something hurts.
Okay.
You can ask him to stop too.
Questions?
No,
Okay. So I think what we'll do is we'll arrange those blood tests, and then I'll once we've got
the nurse goes over instructions with me.
And we have it written here, and we have a food diary also on this document if you want to keep track.
She gives me good advice.
And then if you have any questions, you can always call us. Okay?
Okay,
Great. Well, here you go.
thank you.
And it was nice meeting you,
And
Andrew.
if you're nervous about going to the doctor, I don't do it, but if you want, you can bring a parent or somebody that you trust. That the doctor is there just to check you and to make sure that you're healthy and that you'll stay healthy. Hopefully, stay healthy.
One of the things I just wanted to point out, as you probably realize as you're looking at the form, is that the form that they used in the video was a different kind of form than this one. And I think there's a lot of different healthcare support forms, different health passports, you might hear them called, and things like that. Some of them are more like, this is how I communicate, kind of background information. And some of them, like this one that we're going over today, are really specific to this particular visit. And I think that's really helpful. You can use both kinds. This visit one especially works on dealing with that issue of those like shorter visits of, really thinking about and practicing ahead of time. How am I going to tell the doctor why I'm here today? How am I going to make that a really short story? Like really honing in on the key pieces that I need to share with them. And, really making sure that I've got the questions that I want to ask. And I just want to reiterate what Katie said too, that like that box is not big enough for the questions I would have to go to my doctor for like a regular, no problem appointment. So I definitely think having a list of questions on the back, using half that's your questions and the other half for the answers to those questions is a really good strategy.
Okay, so another activity that we did in our Ready to Advocate for My Health program is really to just practice filling out the form. So practicing a lot before you go to your doctor's appointment so that you feel comfortable with what the form is, how it's laid out, filling it out, those kinds of things. So in our program, we used kind of pre-written case examples so that we could kind of all practice filling it out together and go through it together. And also just to protect people's health information so nobody was sharing anything too personal. So tonight, I want to go through a case example and have everyone practice filling it out so that you can get practice with it. And also then while you're filling it out, if you have any questions, we're here to answer them for you. When you're practicing at home, it might be helpful to practice using like a recent doctor's appointment you've had or an upcoming visit, of course, just so that it's more relatable. But just for tonight, we're going to use a case example. So what I would like everyone to do is download that Today's Healthcare form if you have not already. And I'm going to show you, we're going to kind of pretend like, okay, we are right now preparing for our appointment, and I'm going to give some information and have you practice filling it out during the appointment and after, and then I'll show you mine at the end and we can kind of compare and see how we did, how it went. Okay, so if you're looking at your form, and go ahead and fill it out with me. So we're pretending that we are preparing for our appointment. So I'm coming to the doctor today with my mom because my throat is really sore. I want to make sure to ask the doctor why my throat hurts so badly and what I can do to make it go away. So why don't you take a few minutes and fill out that form with that information. So now we're going to pretend that we are at the doctor's appointment. We're in our appointment now. So the doctor tells me that I have strep throat, and that is why it has been hurting so much. They tell me to take amoxicillin 2 times a day at breakfast and dinner for 7 days to make it go away. The doctor recommends that I take the medication with food so that it does not upset my stomach. Okay, and then now our appointment is over. So our follow-up is that if I don't feel better after 1 week, I should call to make a follow-up appointment. So go ahead and fill out your form with that information. Now everybody's form is probably gonna look a little bit different just because what you pull out of there is really important to talk about, is probably gonna be different than me. So this is what mine looks like. So the before, getting ready for the appointment, I have my name, the date, that my mom is with me. We didn't really put this in the case, but I just put that I hadn't gone to a doctor recently. Why am I at the doctor's or clinic today? I have a really sore throat. If you want to add more detail there, you can. Whatever is going to help you or your loved one the most while you're at the doctor's appointment. In questions I want to ask today, why does my throat hurt so badly and how can I make it go away? For answers to my questions, the doctor says I have strep throat, which is why my throat has been hurting. Then in this case, the medication one was a little bit more complicated. So I put amoxicillin here in the medication name. I'm going to take this 2 times a day at breakfast and dinner. I couldn't spell them both on the line, so I just put B. And then I'm going to take this for 7 days. And then down here at the bottom, and anything else I need to know, I put I need to take my meds with some food. In the follow-up box, I put if I don't feel better after 1 week, I should make another appointment. So again, your form might look really similar to mine. It might look a little bit different wherever you choose to put things. But this is kind of how the form is designed to work, is just to kind of walk you through box by box, what are the steps of preparing for and talking to your doctor while you're there. So I'm not going to pull up the presentation quite yet, because the next thing we're going to do is actually a video review, kind of. So I have a couple of YouTube videos that show examples of people with a disability at the doctor's office. So what we're going to do is watch the short clip and then just kind of discuss what we saw.
And one thing that I don't remember if Katie mentioned or not, when she did this program with adults with developmental disabilities, practicing with the form and watching these videos and talking about them were things that the the people who were in her class said were really helpful. So those are the pieces that we brought forward and that you could use with your family members or to practice on your own. And you'll have, with the follow-up, you'll have these video links because they're in the presentation. You'll have the forms and stuff so that you can build out practice activities. Sometimes it's easier to do with really your own self. If you're just, practicing this at home with your family, you don't have to pretend with case examples. It can be helpful though, if you're having trouble like coming up with something, of just, again, to get familiar with the form and things like that.
We're just going to watch about a minute of it.
More of diet, have diet or low calorie juices.
Yeah.
So
Yeah.
that's good.
Okay.
The other thing I was thinking, we're going to have to change your medication around.
Oh yeah. Okay.
Your sugar is too high, so I want to add something called glucotrol.
I think he already takes that now, don't you?
I think so. Yeah.
Are you sure?
Yeah.
Oh, no, I'm thinking of metformin. That's what you take.
Metformin.
This is a medication that I want you to take with your meals in the morning.
Okay.
Should be one more pill you take in the morning.
Mm-hmm.
And the medication is pretty well tolerated.
Right.
Sometimes you can get a little side effect from the medication.
Oh, what is the side effect?
Sometimes it can give you a side effect of diarrhea.
Mm-hmm.
Okay.
Yeah.
So I just want to make sure that you understand. You're going to take this medication when?
Only in the morning.
Okay, good. And what is a side effect of the medication?
Diarrhea.
Okay. Now, do you understand the importance of the medication?
Yeah.
What does it help to do?
Control diabetes.
Very good. Yeah.
That was just a really quick clip. So now that we've watched that, I think that first clip was kind of overall a pretty positive doctor's appointment, doctor's office visit. So we can see that the doctor is speaking directly to the patient and checking in to make sure that the patient understands. We see that the patient kind of advocates for himself and asks the doctor follow-up questions about side effects. So I have a couple of questions that I want to get your thoughts on. So we're going to use something called the Google Jamboard. I don't know if any of you have used it. I'm going to share what it looks like. So this is what the board looks like. So in that last clip, my first question is, what do you think went well in this appointment? But I'll just take a minute and kind of fill out what you think went well in the appointment. So I'll go ahead and start talking about this first one. So what do you think went well in the appointment? The doctor spoke directly to the patient. The doctor made sure that the man knew why he was taking the new med. Yep, very important. The doctor asked questions to clarify understanding. And the person with the disability was the primary speaker, but the staff was there for clarification. Yeah, so the person with disability kind of was in charge of the appointment and the staff was there for support. Definitely really important. And then what we have on the second one, so what else could you do to advocate for yourself? Ask what to do about diarrhea or if there are other medicines and about the side effects. Somebody else asked about that. Ask what I should do if I get diarrhea. So if you get those side effects, what should you do about it? Other options for medications without side effects. Yeah, that's an important one that I think a lot of people forget, is that even when a doctor introduces a medication, that you can ask too to see if there's maybe a different one as well. Ask what else to do for diabetes and ask other ways to manage blood sugar. I think those are all really, really good things that they can do to advocate for themselves. We have one other video that I want to show, just a few seconds worth.
Because I think, looking here at everything that they've told me, I think we're going to have to add another medicine. Yeah. Okay. Any trouble taking them? No. Does she? All right. What I'm going to do is I am going to have to add another medicine that's going to be difficult for her to take. And the medicine that she's going to need to take has to be taken at a specific time of day. It's going to be very important that she takes it at least a half hour before she eats. And there are 2 other medicines that she takes that she can't take this medication with. So we're going to have to make sure we stagger the doses.
If you write it down, then I guess our nurses will take care of it.
Okay. And the other thing, this medicine interferes with her Coumadin. So we have to make sure that we check her blood levels more frequently than we've been doing before.
I guess just write it down.
So when I watch this clip, what I see is a caregiver not really paying attention, right? And also that the doctor is speaking really directly to the caregiver instead of to the patient. And the patient is just kind of a bystander at her own appointment is kind of what I see. But I want to know what stood out to you in the video. Okay, and then when you're done with that question, have one more question, the last one. So if you were in that situation, if that was you, if you were the patient, what else could you do or say in this situation to advocate for yourself? Or if you were the support person for that patient, what could you do to help that patient advocate? So the first question, what stood out to you? The person with the disability is totally ignored. Absolutely. The support person was not engaged, really distracted. There was no investment from the staff. They wanted it written down for the nurse, but the nurse wouldn't be there to see reactions at home. Yep. It was hard to understand the doctor. It was too complicated. I agree. Yeah, watching that, I was really confused what was happening as well. And then the medication sounded hard to take. Yeah. Okay. And what else could you do or say in this situation? Scream. Yeah, that's a good one in this situation. Ask more questions. Absolutely. Ask, why are we making changes? Yeah, that's really important to know. Ask the doctor to speak to me, or say, please talk to me. Yes, absolutely. Or say, I don't understand. Or, if you're the support person too, or the caregiver, saying, please talk to so-and-so, please talk to the patient. You can fill that role too, and kind of directing the doctor to speak to the patient.
So we wanted to kind of loop back around to the beginning again and remind you that, we've talked about a few things here tonight around developing self-advocacy skills and improving communication in healthcare settings. Just to remind you again, this is not a one-time deal. It's something to keep practicing. And again, practice it at home before you're trying to practice it in the doctor's appointment, that it's okay to do one part at a time. It's okay to, figure out what are the easiest parts to do and to have the person with the disability start there, and to really just get them more actively involved in the appointment. And so we've hoped that you've gotten a little bit of examples of some tools and supports to help people with disabilities to be as involved in their healthcare decision-making as they want to be. And then also, just so that y'all know, for the handout, we weren't quite sure how the time was going to go. And so we had some bonus activities that will be included in the handout. So there's a second case that you can use on your own to practice with the form. And then there's also the other health form that was on the Charting the Life course form about your healthcare team and support needs. And so we've got a picture of that form at the end of the handout as well. And then you find it right next to the Charting the Life course tool.
I just wanted to say that we have a comment that you shouldn't run away from doctors. And I do think people are intimidated when they're in a doctor's office. So I'm really glad that we're encouraging people to think in advance. Are there other things that you encourage people to do so they feel more comfortable with their healthcare professional?
Yeah, I think that it's important that you find a doctor that you feel like you can talk to. That sometimes takes a long time to find a good fit. And I think it's really hard, especially as teenagers get older, to move from their pediatrician to an adult provider, and just knowing that that's going to take some time and some essentially doctor shopping to figure out a good fit, and that it really is okay to try out different ones. I think like doctors are not the most accessible place either. Like doctors' offices are not the most accessible place. Like the physical accessibility of just, can I even get in the room? Can I get in the exam room if I use a wheelchair or something like that? And then, thinking about the lights and the noise and the smells and all those kinds of things. And so figuring out if there's a good fit with that. And asking for, rather than being moved from room to room, if the person that you're supporting has difficulty with those transitions, to just say, can we go to like one room and wait? Kind of thing. Is there a way to minimize the wait times, to talk to the office staff about those kind of accommodations with scheduling, to let the doctor's office know if you know that it's going to be a longer appointment, so that they can schedule it accordingly. Those are all like examples of things to maybe be able to do.
I think those are really important. And I think sometimes families don't know that there are doctors that make those accommodations. We support a lot of people residentially, and they will make them first appointment of the day so they can walk right in. Or we've had doctors meet with people in parking garages who just wouldn't go into the doctor's office. So we've had somebody ask about tips for doc shopping. And I will say, on the ARC's end, we maintain a list of doctors that families have recommended. So you can always call a family navigator or ask other families. I think they're great resources. Wanda or Katie, do you have other recommendations?
I think one of the challenging parts is like getting a recommendation from a family member, and then just making sure that you take that extra step to make sure that they are on your insurance network, because you don't want to find a doctor that it's going to be like not work out with your insurance.
Our doctor's office recently said they were basically given 20 minutes to only discuss preventative care during our annual exams, and discussing anything else could cost extra. Tips for how to prioritize what we talk about in those 20 minutes.
I think that that's a good thing to know going in. It's really helpful that you know that that's how much time you've got, kind of thing.
I think my thought with that is, I know maybe not all doctors' offices, but I know a lot more doctors' offices are incorporating some form of like my chart or something like that as well. So I think like prioritizing kind of maybe the main things that you want to talk about. So maybe it's making a list of all the things you want to talk to your doctor about, and like highlighting the ones that like you really want to talk about in person, and then maybe like asking about any form of my chart, or sending those questions maybe even ahead of time for the appointment, to kind of get more information out of that short appointment window.
That's a really great suggestion. And I think everything you've helped us with in terms of thinking in planning in advance will shorten the time we need for the basics. There's another question. My daughter, who has Asperger's, is hesitant to have me involved in her appointments. Are there strategies that you can recommend for me to inform her doctor about any relevant background information or concerns? Is it a good idea for me to reach out to the doctor's staff separately?
So my first thought about this question is whether or not the daughter is an adult. And so if she is an adult, then I would be very, very hesitant about reaching out to the doctor's office separately. I think, maybe having some tools that you work on together ahead of time, something like the today's healthcare visit, or something like a health passport that is like essentially a previous medical history, or a like important things to know kind of thing, to have her bring to the doctor's office to share with them. I think that piece around like, why am I here today? Kind of linking back to that last question as well. I think that's a place that everybody could benefit from spending a little bit of time really thinking about, how am I going to answer that question? Why am I here today? In a way that is as short as possible, straight to the point, but gives the nurse and the doctor the essential information that they need. I think that would actually help all of us to really be clear on, what do I want to cover today? If it's something of like, and I literally do this myself. Like, okay, I'm going in for a checkup and I need to make sure I'm asking about this, and I need to make sure I get a refill for this medication. And you know what? My ears have been stopped up. And so I want to make sure to tell them about that as well. And so, okay, I've got these 3 things that I really want to focus on during this visit for today. And then there might be other things that, like Katie said, that I could follow up on via an email or an electronic communication, either before the visit or after the visit.
You may also want to look at those lifecoursetools.com on the healthcare page, because there's some more detailed health planning documents there. If your family member with Asperger's will take some time and fill out some of that information with you, it has previous health experiences that might be important to know. So even if they don't take that into the doctor, that gives you a chance to have a conversation about, why would it be important to share that with the doctor? And I think that's one of those challenges all families have, is to, give your family member that opportunity to speak up for themselves, but make sure they understand the consequences if they aren't giving enough information. Good night, everybody.